Elder abuse is a complex issue, and it's been defined by the World Health Organization, or WHO, or the INPA, as a single or repeated act or lack of appropriate action, and occurring within a relationship of trust between two people, where there's an expectation of trust between the carers and the older person, and this action actually causes harm or distress to the older person. Warning signs of elder abuse basically differs according to the subtypes. So you've got things like physical abuse, and things can be something like unexplained injuries, unexplained fall, unexplained bruises. Psychological abuse or emotional abuse, when you see that the elders or the older person are slightly withdrawn for no reason, or when you find that hesitation in speaking when someone is around. So these are some of the telltale signs. Disturbance in their sleep behavior, in their sleep patterns, and neglect, things like poor hygiene or malnourishment, or in fact even unclean living situations. So when you have neglect, there is this thing about neglect in a sense that it's considered as intentional when the older person is abandoned, but it's also considered as unintentional when the carers or the caregivers do not know or don't have the skills to take care of older people, or when the spousal caregivers themselves are also elderly and they might themselves be ill, so they're unable to take care of another elder person, which is quite common. Ask for help if you need help, and respite care at a regular basis is also very, very useful. You would need some time off for yourself as well, and if you have a support group, that's great. If you have family members to take a rotation or look after the elders, that's also great. And I suppose you need to educate yourself. Education is very important. Simple things like what is good for the elders, what type of food they should take, and sometimes our weather can be extremely hot, so how much water they should take. In fact, even fiber intake, if that could lead to constipation if you don't give enough fibers. So knowledge is very, very useful. And watch for family members' changes in their moods and when you're taking care of them. The formal channels will be the police, right? So that's 999, I believe. And of course, there is this Jabatan Kebajikan Masyarakat, or the District Social Welfare Department. So that's according to where you stay, whether you're in Petaling Jaya or Kuala Lumpur. They have their phone numbers that you can call them. And then under the LPPKN, there's this Talian Nur or Talian Kasih. So that's 15999. Also a number that you can call and you can talk to. And hospitals would have the OSCC, or One Stop Crisis Center. So this has a multi-approach where you have the medical people there, the legal people there as well, and that they can help you.